we will hear a presentation from Dr. Geddes called The Health and Wellbeing of Breastfeeding Women Across Australia and New Zealand During the COVID-19 Pandemic. Dr. Geddes is Professor of Human Lactation, a Senior Principal Research Fellow, Faculty of Science School of Molecular Sciences in the University of Western Australia. And because Dr. Geddes is from Australia, her presentation is recorded because I think it's about 1 a.m. her time.
Hello everyone, I'm Professor Donna Geddes and I'm currently sitting in my office in the University of Western Australia in Australia. And I am very thrilled to be able to present preliminary results from a survey we are currently conducting online, so an anonymous online survey. So because we have very low rates of infection here in Australia, we decided not to collect milk samples from breastfeeding women because we had both ethical problems and the fact that we had low rates, as I mentioned. So we were interested then in the health and wellbeing of breastfeeding women across Australia and New Zealand during this time. First of all, I'd just like to declare my conflict of interests, which are mainly my funding sources, from the dealer, from our government, which is NHMRC, from Singapore, which is an institute attached to the University of Singapore, and a couple of foundations there that you can see at the bottom. Now, I know we're probably talking to real enthusiasts and supporters of breastfeeding, but the reason we're really doing this research is that we know that human lactation is the foundation of a healthy life. So the programming that begins in conception and pregnancy of our children is extended into the first 2 to 3 years of life and is related to nutrition. So basically, human milk has a role in programming the short and long-term health outcomes of our babies. COVID-19 struck Australia around a similar time, maybe end of February, March to the rest of the world. And we have had quite different experiences, perhaps, if you compare us to both the US and Europe. So what we did was we designed a survey, an actual suite of surveys for the online anonymous survey project. And we recruited specifically women that were breastfeeding a baby under 7 months. And what we're doing is administering those surveys every month for 6 months. So it's actually a longitudinal study. But today you'll see the preliminary results of the first arm of the survey. Now, we just need to bear in mind that there is a lot of recent work that are showing other factors that we haven't considered previously that affect breastfeeding. And that perceived pressure to breastfeed, the guilt of stopping breastfeeding, and not having enough milk perhaps has been a long-term issue for mothers, but coping with the demands of baby, housework partner and other children is starting to emerge from these studies. So you can see that there is possibly a link between lockdown and mothers being at home, homeschooling with their children and partners, where breastfeeding may be impacted. We also know that the maternal rating of the importance of breastfeeding is one of the major factors that determines duration. Notwithstanding the fact that there are socioeconomic impacts, work, cultural, and more recently, depression, stress, and loneliness. So we know that these factors here are associated with a reduced duration of breastfeeding, hence a possible link with breastfeeding rates during COVID-19. So our initial aim in this study was to determine whether the stresses that women were experiencing during the pandemic, did it affect their breastfeeding and their breastfeeding choices? To do that, we harmonised our surveys with Origins, that you can see here, which is a developmental origins of health and disease cohort where 5,000 families are recruited in pregnancy and followed for the first 5 years of life. So that's situated in a hospital called Joondalup campus up in the northern regions of Perth. So Origins and ourselves administering a behavioural and demographic questionnaire. So the behavioural questionnaire includes things like how often women left the house, how often they're exercising, how often they're watching the news, and things like that. A perceived stress scale, again, a validated questionnaire. The McMaster Family Assessment Device Hardship Scale. So really that looks at financial hardship, mental health continuum, the perinatal anxiety screening scale, and we've shown that these two are very highly correlated, which is good. And then, so I added an infant sleep questionnaire, the validated one from the literature, and a feeding questionnaire, which was an adaptation of the CDC infant feeding questionnaires to investigate how mothers were deciding what they were going to do. So these three here are in addition to Origins. The harmonisation of these four will allow us to combine and get much greater power to look at the wellbeing of our mothers. We have also administered these questionnaires to a longitudinal observational cohort that we have recruited through our lab. So we recruit the mothers in 36 weeks gestation, and we sample milk across the first 12 months of life. So you can see we've got colostrum and monthly samples, and then 9 and 12 months, and we're about to hit some of the 24-month-old babies shortly. We collect a lot of metadata, dietary information and medications and health data, but we also importantly collect milk, maternal faeces, infant oral swabs, infant faeces. We do body compositions on the mothers and the babies, and also measure their growth through normal anthropometrics. So the idea of implementing to the survey into this study is that we can look at differences in the composition of milk in the microbiome. So for example, if mother's nutrition is quality is decreased, are we seeing that being reflected in either the growth of the baby or milk composition? And the same goes for stress factors in the milk, which have shown to be related to milk, to infant growth, as well as their temperament. Unfortunately, we won't present these today, but we are going to look at the more global study first. Just to point out this hardship scale here, the reason I'm doing that is because it features heavily in our results as an impactful part of what's happening in COVID. So the mothers answer yes or no to these following questions, and you can see that they're quite substantial questions in terms of creating quite a lot of stress if you can't pay your bills or your rent or mortgage, or go without meals, or unable to heat or cool your home. Have you pawned something, or sought assistance from a welfare or community organisation? The other part of the survey that we will touch on today, but there is a qualitative aspect to it, and so there are worries and concerns, so we track those across those 6 months that we administer the survey. And then, can you tell us about a challenge you faced in the last 2 weeks? As well as the more positive aspect of what did women find about the COVID pandemic that's making their life easier or actually more enjoyable. So we actually made this available online globally, but really most of our respondents came from Australia and New Zealand here. So we've left the rest of the world out. So there's something like 30 participants from a diverse number of countries. To give you a little bit of a background and where we expected to perhaps see the greatest changes is the difference between what's happened in Western Australia, the rest of Australia and Victoria. So our Victorian colleagues experienced, much like the rest of the states in Australia, an increase in COVID cases around March here. You can see that. And then when restrictions were put in place, we had a delay, schools reopened and there was a slight increase, but you can see that it's very kind of level and low here. And then in June, July, we got a second wave. And it was quite, you can see the difference, it was quite extreme. So currently our Victorian people are still in lockdown with only essential services. No schools are open, no universities are open, and there are curfews for the Victorians. Whereas in Western Australia, we had our increase in COVID cases, the first wave in March. We had quite strict border lockdowns very early. So we locked down the borders to foreigners coming in. So we reduced our transmission from overseas people coming in. And then we actually closed our regional borders quite early as well. So we were unable to travel outside of Perth. So within WA, we were locked down essentially, but we are still, our borders are still closed to the rest of Australia. And you can see that you've got a long period here where we are staying very, very low in terms of COVID cases. And just to tell you again, Jacinda Ahern had a slightly different approach in New Zealand, and she created a bubble concept where she locked down the country very hard, very early on, and you can see the first wave here, and then they've virtually had no cases at all. They've had a small spike for which Auckland is now locked down as they continue to diminish transmission. And she used a bubble concept where people only had certain people allowed contact with them in their bubble. So you can see that the measures have been quite effective over here for the transmission of COVID. So let's look at who responded in this survey. And you can see here we've split this into Western Australia, Victoria, the rest of Australia, and New Zealand. So you can see that most of the responses came from WA, but they were fairly reasonable for the rest of the groups. We've recruited essentially women in their early 30s, the mothers of term babies, so that was something as an inclusion criteria. Our first-time mothers represented anywhere from a third to half of the respondents that you can see here, and they were very highly educated. So you can see that most had a bachelor degree, but then the next steps below that were at least diplomas and what we call a TAFE qualification, so more of a trade kind of education. The babies were around about 3 months on average when the mothers first enrolled in this study, and most of them were married or had partners. So we have a bit of a bias here, but that's usually reflected in these studies that I've been looking at recently as well, where surveys have been done in the UK, for example. So what we found was quite interesting with respect to breastfeeding. You can see that 80% of women, apart from New Zealand, who's had more like 70%, were feeding their own breast milk or expressed breast milk. So they were breastfeeding and expressing. And the ones that were feeding exclusively breastfeeding were also quite high. We didn't see any statistical differences between the regions. And then you see that around about 6 to 10% of women had introduced food to their babies, and also similarly had introduced formula. Now, because we asked about the problems that mothers were experiencing, statistically there was a relationship between those who introduced food and formula that were perceived or had low milk production. So that was perhaps not driven by choice or social determinants, but rather more perceptions around the baby's demeanour and how they were settling after feeds. You can see here that there are a number of concerns that mothers had in lockdown, not let down. And you can see that sore nipples are really top of all of the problems they had. So you've got a quarter to a third of women experiencing this. And then you've got about half of them having nipple damage, although this is greater here in New Zealand. We seem to be experiencing less attachment difficulties, but that's around about 20% across the regions. And the nipple shield use is around about 16 to 15%. And you can see that's very similar to those that are experiencing nipple damage. Block ducts feature here, more so in Victoria and New Zealand, and mastitis is quite high, so in the realms of 10 to 15%, with a low supply incidence of around 6 to 12%, which we would expect. Interestingly, oversupply has seemed to become a problem for a number of mothers that we've seen in our lab here as well, and that ranges from 9 to 20%. And then you've got about half of women reporting that they had no difficulties at all. So let's start looking at what is going on with the well-being of our mums and their health. So if we look at their self-reported anxiety, you can see here that Victoria takes the cake. WA follows, we follow slightly more here, but it ranges from 10 to 30%, which we would kind of expect in terms of anxiety. And then we see rates of depression, self-reported depression, around 15 to 10% here. Okay, and what we did also was look at a number of metabolic disorders that are associated with low milk supply, and you can see we have 10% in the realms of quite low, 10% here of PCOS, polycystic ovarian syndrome. We have diabetes, and this was diagnosed before pregnancy, so type 1 or type 2. And then we have fertility issues and thyroid disorders. So the reason we chose those is that the hormones involved in those metabolic disorders are also involved in the breast development and milk synthesis pathways. So what were our mums doing? And how were they feeling? So most were employed on maternity leave, and few had their employment impacted, so the mother's employment. However, we do know that there are some worries of whether they would still have their jobs after maternity leave. Our mothers comprised a third to half of them of health professionals or students, and you can see here that we have quite low rates, 30 to 40% of women that are only leaving home 5, 6 or 7 days a week. So they're spending half of their time at home. And same again here, we've got quite low numbers of mothers that are going out and exercising 5 or more times a week. And we have obviously higher rates of those avoiding contact with 65-year-olds and elderly people in Victoria because they're locked down. A lot of them are checking the news daily, but very few are in self-isolation. So if we look at the rates of anxiety in these women, you can see this is minimal. So most mothers have minimal anxiety, so over 40%. The red is the missing data. And you can see here that the mild to moderate ranges from about 13% to 35%. So we've got a large chunk of mothers sitting right in that mild to moderate section. And then we have a smaller number with severe anxiety symptoms, but it's not insignificant. So it's up to around about 10%. If we look at our other scales here, we have again around about 6% of women in the perceived stress scale rating as high, whereas most of our mothers sit in the middle there in a medium stress level, and about a third in the low. Of concern is that, in the mental health continuum, we have about 3% of women languishing. Again, most of them sitting in the moderately mentally healthy, but we have a number that are flourishing as well. So we have that dichotomy going on where some women are doing really well and others are struggling. You can see the financial hardship is not insignificant either. It's around about 20% that are experiencing problems paying their bills. So if we look at the statistics and we factor in hardship and sleep to look at this infant sleep, to look at the levels of anxiety and stress experienced by women. This is linear mixed modelling Okay, so basically that accounts for what region the mothers were in, the hardship, going out to exercise, feeding frequency, and a number of the infant's sleep variables. And you can see here that hardship really does make a massive impact when we start modelling these outcomes. You will get much more higher levels of anxiety as hardship increases. But interestingly, entwined in this is taking longer to put the baby to sleep also increases the mother's anxiety. Again, you see the same here with the perceived stress scale, where hardship increases stress. And again, taking longer to put the baby to sleep also increases the perceived stress. Even when it comes down to family dynamics, so this is the family influence and how well the mother feels supported by the family, taking long to put the baby to sleep pops up again. What was interesting in the univariate statistics was the very fact that if you were breastfeeding, you had felt better supported by your family. So the very act of breastfeeding, we know, changes the physiology of the mother, and all that oxytocin makes her more calm, perhaps, and resistant to repetitive tasks. But also the interaction with the family was associated with breastfeeding itself. So we're hoping that when we do the more complex modelling, we'll see more of that, and especially if we include our other cohort. To give you a snapshot of how long it's taking mothers to put their babies to sleep, you can see it's quite a skewed distribution. Some women are taking a very long time. So this is minutes along here. So over an hour, there is a number of women spending that amount of time trying to get their babies to sleep. And you see here that most of this proportion sit in the 30-minute range, and a large proportion sitting in the hour range, which suggests that this is intricately entwined into the mother's well-being, that it's something we should be addressing and talking about expectations of biologically normal sleep in babies, particularly when mothers are in lockdown and have a lot of people around as well. Another thing that popped out in the univariate models was if the mothers exercised 5 or more times a day, it was actually protective of the mother's well-being, which is, I guess, no surprise. So what we have is that we have the financial stress being a major factor in causing stress in the mums and well-being, as well as expectations and perceptions around how long it takes the baby to get to sleep. But this is somewhat offset by exercise, and if the mothers can actually leave their homes to get some exercise. I'd like to finish on a more positive note by just letting you know that we've had a preliminary look at the positive question. Can you tell us how lockdown has made any parts of your life easier or more enjoyable? And there are 3 themes that appear to come out: more time with the partner at home, time to connect with family, and reduce pressure to do extra tasks. For example, have visitors and go out. So these are some of the quotes from the mothers. And you can see that more time together as a family due to husband being home usually works away. So we have a big mining contingent where husbands are away for 1 to 2 weeks and then come home for a week and go away again. Less stress about being places on time, having the house clean and tidy for visitors that might drop in. Husband is home working, so he's able to do more of the running round for the older 2 with regards to school and childcare drop-offs while I'm at home with the baby. It took the pressure off to get out of the house. It also made me exercise every day. And this is a really nice one. You know, I have been able to bond with my daughter without having other commitments. So really, to try and summarise what I've told you so far in the first snapshot of this survey is that the pandemic is impacting the well-being of breastfeeding women. So we still have a high incidence of breastfeeding problems, yet we have high levels of breastfeeding. And we need to acknowledge that many of these women are suffering financial hardship, and this is one of the drivers of their stress and anxiety. So it may be that they were continuing to breastfeed because it's an economic choice as well. We need to ensure that we ask about infant sleep and educate around those reasonable expectations, and remember that exercise is protective for the mother. And we also have a protective effect of breastfeeding, of course, that we haven't quite finished analysing. So with that, I would like to just acknowledge the people on this project, particularly Jackie McEachran, who has organised REDCap and all of the surveys and is monitoring those. Alethea Ray, a biostatistician extraordinaire, and Vanessa Sakalides, who is locked down in Switzerland, or not so locked down now, who's a biostatistician in the making, as well as Sharon Perella, who is our postdoc neonatal nurse, lactation consultant, all things clinical, to help with the interpretation of the results. You can see my research team here in the middle of COVID having a lab meeting, and of course they all contribute in one way or another. So thank you for your time. I'm happy to answer any questions virtually, and stay safe and take care.